You feel it. Chest pain, shortness of breath, your heart racing. Is it stress, a panic attack, or something worse? What if the one thing you're doing to calm down is actually making it more dangerous? Let's become more aware together. In all my years seeing patients, there's one scenario that happened over and over again. Someone rushes to the ER, convinced they're having a heart attack. Their chest hurts, they're sweating. They feel like they can't breathe. But after tests and scans, it wasn't their heart. It was panic or stress, or both. I would often see these patients later in primary care, and they were confused. Why did it feel so real? And honestly, it was real. Because panic attacks and heart attacks don't just share symptoms, they hijack the same systems in the body. So in this video, I want to help you understand how to spot the differences, when to take action, and how to avoid misinterpreting one for the other, because what your body is trying to say can be life-changing if you know how to listen. Let's start with the overlap. Heart attack, panic attack, stress, all three can cause chest pain or tightness, sweating, nausea or vomiting, shortness of breath, feeling weak or lightheaded, having a sense of dread. These symptoms can be confusing to anybody, but it's the flavor of those symptoms and what surrounds them that gives us clues. Heart attacks often build quickly, especially during physical exertion. The pain tends to radiate to your arm, jaw, or between your shoulder blades. And the pressure, it's like an elephant on your chest. Unlike stress or panic, it doesn't come from worry or avoidance. It's mechanical, biological. Your heart isn't getting the oxygen it needs. Here's some clues to tip you off to a heart attack. Pain during or after exertion. Pain that builds and peaks in minutes. The pain and pressure radiate to your arm or jaw. It's not relieved by relaxing. It's often not tied to emotions or fear. If you even suspect this, call emergency services immediately. Better a false alarm than a fatal miss. Panic attacks hit suddenly, often without warning. They can mimic heart attacks almost perfectly. Racing heart, trouble breathing, sweating, dizziness. But panic attacks often come with a fear of dying that feels out of proportion. And the twist? The fear creates more symptoms, which creates more fear. A feedback loop. Here's some clues that it's a panic attack. It's triggered by anxiety, worry, or past traumas. You'll notice tingling or numbness in hands possibly, shaking of the body or extremities. It often leads to a fear of future panic attacks. It improves with calming or grounding techniques. It feels physical, but is driven by overactive survival systems, not clogged arteries. Stress doesn't always crash in like a heart attack or a panic attack. It's sneaky. It builds slowly through things like insomnia, gut issues, headaches, body tension. But when left unchecked, stress becomes a background radiation that primes your body for both panic and cardiac issues. Here are some stress-only symptoms. There's a delayed, gradual onset. You might have associated digestive issues like IBS or GERD, tension headaches or migraines, general muscle pain or tightness, feeling like you're on edge or burned out. Sometimes the body whispers for help before it screams. Some symptoms live in two categories. Let's look at heart attack and panic attack together. There's a sudden onset, a fear of dying, feeling paralyzed or frozen. How about stress and panic attack? You've got butterflies in the stomach, heart racing, cold hands, tight chest pain that changes with posture or pressure? How about stress and heart attack? Chronic muscle tension, a subtle worsening over time, more dangerous when ignored. It's not about guessing perfectly. It's about responding appropriately. Here's a rule of thumb. If symptoms are new, worsening, radiating, or happening with exertion, go to the ER. You can always treat anxiety later, but you can't undo a missed heart attack. If you've had panic attacks before and this feels similar, grounding can help. Sit down, name 5 things you can see, 4 things you can touch, 3 that you can hear. Breathe with longer exhales than inhales. Remind yourself, I've survived this before. But if it's the first time or you're unsure, get yourself checked out. Your body speaks in sensations. And while symptoms can feel the same, what they mean can be very different. So the next time something feels off, pause and ask, is this fear, fatigue, or a true emergency? Because how you respond in the moment might just save your life. So let's become more aware together, one step at a time.